Good afternoon, and thank you to everyone for being here today on this Tuesday after Memorial Day. I hope everyone had a good weekend, and hopefully most everyone was able to get some rest. I don't have any major news to share today, but I did want to come here and give you an opportunity to get an update and to answer any questions that you may have, since it has been 3 days since we've gotten together. We do continue to see a steady number of cases in our state. That number is not declining significantly, and it certainly should serve as a warning to all of us that this disease is not disappearing. We have to stay vigilant. At the same time, our active hospitalizations, our ICU patients, our number of ventilators, and our total number of deaths, every single one of them being a tragedy, have continued to stay relatively flat. The number is so low that they fluctuate every single day, but it looks like the number of cases is primarily driven by finding asymptomatic or unserious cases through our ramped up targeted testing. We had a call earlier today with the coronavirus task force. Dr. Birx actually said to the entire group that finding these asymptomatic cases is actually a good thing. And increasing cases driven by finding cases such as this is critical to containing the virus in the long term. She shared that this is the goal, not a problem, and asked us to communicate that with all of you. Targeted, aggressive testing like this is why our hospitalization rate is going down. We're on pace to comfortably hit our testing goal for the month of May. We're also testing aggressively in our most vulnerable populations. It doesn't mean that the risk is lower. It just means that we're finding more cases and getting even better data. We just updated today at the State Department of Health our number of recoveries. 9,401 Mississippians have recovered. That means that we've got approximately 3,678 active cases in our state today. The most impactful testing push has been in our long-term care facilities, specifically our nursing homes. A week ago, we set the goal to test all of our nursing homes in a 2-week period for 14 days. I want to report to you today that we are a little over halfway there. Remember, that was testing approximately 17,500 patients and approximately 10,000 employees in each of these facilities throughout the state. I'm proud of the progress that we have made there, and we'll continue pushing forward to meet our ultimate goal of testing every single one. To everyone working and living in a nursing home, I know it's not pleasant, it's not fun, but it is necessary, and in the long term, it will save lives. It is probably the most meaningful thing that we can do at this point in the cycle. We also had our state economist give a presentation this morning, I understand, to the members of the Mississippi Senate. He warned that Mississippi is entering a sharp, painful recession as a result of this virus. He warned that the recovery will not be instant. He expects a short recession and a long recovery because the damage is very deep. We know that we have a long road ahead. The most important thing to me was his point about what we don't know. Now, politicians do not like to admit when we don't know things, but I'll admit that in this pandemic, I do not have all of the answers. I do not know what the virus is going to do through the summer. I do not know exactly what the fall is going to look like. I do not know when exactly Mississippians will be able to engage in the economy enough to get us back to better, higher levels. I have been exposed to more data and more information than just about anyone in this country. I have access to more capable, competent experts than just about anyone in this country. I still don't know what the summer is going to look like. I still don't know exactly what the fall is going to bring us. And I would submit to you that no one else knows for sure either. All of us have to have the humility to admit that we don't know exactly what the future holds. But we do know one thing for sure. Right now, we have not only a public health crisis before us, but also an economic crisis unfolding. It is going to take continued effort, continued engagement, and continued empathy by all of us. We have to keep fighting. We have to work to stay safe. We have to work to keep our friends and our neighbors safe. And that's exactly what we're going to do here in the great state of Mississippi. With that, I'd like to turn it over to Dr. Dobbs to give us an update.
Thank you, Governor. Today we're reporting 273 new cases and unfortunately 17 additional deaths. We have 121 ongoing outbreaks among in long-term care settings. Speaking about our testing initiative for all of the nursing homes, as of yesterday, we had completed almost 60% of the nursing homes thus far, with an anticipation of being able to finish on schedule. If there are some delays, it shouldn't be far beyond that, but certainly the teams are working fantastically, and we expect for them to be successful in the very, very near future. If we look at hospital utilization, we have had overall stability with a mild decrease today compared with previous, with 388 hospitalized patients with coronavirus, 134 in the ICU, and 81 on ventilators. We have distributed Remdesivir, the antiviral drug for coronavirus, to 29 hospitals in Mississippi, enough doses to serve 351 patients, with a total of 2,106 vials for patients suffering from coronavirus. If we look at our testing numbers, we have tested thus far 154,624 times, and of that number, 6,805 were serology tests or blood tests that look for the antibodies. Of that 6,805, only 95 were confirmed cases of coronavirus, so a very small minority. And if we look at what's going on with different counties in the state, we have had some increases in some other areas. Specifically, Wayne County has had a marked increase in cases over the past week. Wayne County was number 3 in the total number of new cases for that period and is number 1 in the per capita. We're going to invest a significant amount of time and resources investigating and seeing what we can do to mitigate that spread. Jones County is also having a significant number of cases identified, now number 1 on new cases, but per capita further down on the list, but something we're also going to investigate and try to intervene with further. A couple things I do want to mention. We did last week have an event at a funeral where a contagious patient did go to a funeral and exposed many, many people. So please, this is not over. The funerals and churches and mass gatherings are places where we saw outbreaks very on in this pandemic in Mississippi. We don't want to repeat that before, so please be very careful with your social distancing, even when I know these painful situations and you want to hug and kiss and share. But especially if you're symptomatic, do not go. Do not go to church, do not go to a funeral, do not go to a wedding. We don't want a funeral to lead to more funerals, which we have actually seen that. So please stay home if you're ill and honor the social distancing principles that we know are very important and effective in protecting us. And the only other thing I would just like to mention is certainly virtual worship services, are recommended as the safest way to go. But for people who are having in-person worship, I just really do strongly encourage you to look at the governor's recommendations about how to be as safe as possible. And that's something we've also posted on the Department of Health website if you need the details of those recommendations. And that's all I have, Governor. Thanks, sir.
Thank you, Dr. Dobbs. At this time, I'll turn it over to Director Michelle, who's going to give us an update from the emergency management team.
Thank you, Governor. Thank you all. Just a quick update on PPE yesterday. While most everyone was celebrating the holidays, the National Guard and teams from Mississippi Department of Health and MEMA were out delivering PPE to 31 of our Tier 1 facilities in the northern districts, 1, 2, and 3, yesterday. Today, all 82 counties, as well as the Mississippi Band of Choctaw Indians, are receiving their county deliveries of PPE, as well as 1 Tier 1 facility in Panola County. Would like to just make a note, Governor, we have distributed thus far approximately 2.25 million masks toward the community mask program. And of those masks, sir, about 500,000 of those masks were made right here in the state of Mississippi. Federal declaration update, really quick on the Easter tornado, April the 12th, on individual assistance. As of today, 2,429 individuals that applied for federal assistance. Of those individuals, 592 applicants have been approved for individual assistance in the amount of $3.4 million. Also, to those residents that were in receipt of the Individual Assistance Award, residents of Clark, Grenada, Jasper, Lawrence, Panola, Walthall, Jones, Covington, and Jefferson Davis counties, you are reminded that you have until June the 15th to apply for individual assistance. Again, you have until June the 15th to apply. Please make note of that. We did close down the disaster assistance centers that we had for face-to-face operations, did close on Friday due to low use. Most everyone is taking advantage of online or toll-free numbers to make their applications. For the same storm, for public assistance, we are still awaiting FEMA's approval for the 26 counties that we'll be adding back to that declaration. I appreciate those counties and your municipalities' patience in waiting for FEMA's approval. Due to the virtual process of approving and doing those joint damage assessments, they're a little backlogged, but we should be hearing soon back on that for those 26 counties. For the April 22nd, 23rd, we are awaiting, we were approved Friday for an extension on our deadline to apply for public assistance for the 11 counties in South Mississippi. We anticipate getting approval on that in the next few weeks, but we'll keep you posted there on that as well. We had a great call with the state of Louisiana this past Thursday with regard to contraflow planning operations. It went very, very well with our in-state partners, Mississippi Department of Transportation and Mississippi Department of Public Safety. I'd like to thank MDOT for their coordination efforts on the call, and it was good to hear that the state of Louisiana and Mississippi will be mirroring our messaging with regard to the use of contraflow as well as utilizing shelters and the messaging there. We will continue to update our website with that messaging as we get closer. Also today we had a call with the American Red Cross as well as the Mississippi Department of Human Services. It went very well on our planning for operating shelters during a COVID pandemic. We understand that there are going to be certain challenges associated with operating shelters during the pandemic, but we were certainly relieved to know that we had the resources that would be necessary to provide those shelters should they be necessary. We are less than a week away from the official start of hurricane season, but as we all know, we've already had one storm this year, a little early, Tropical Storm Arthur. We will continue to encourage Mississippians to add PPE to their disaster supply kits in the event that they do have to evacuate and also go into a shelter. And then finally, we'll be adding COVID-19 considerations during the hurricane season for this year. And I want to thank Mallory and her team. And you can see those updates on our website at www.msema.org as we move throughout this hurricane season. Governor, that includes my update for today, sir.
Thank you, Director Michelle. I found it striking on our call with the coronavirus task force at the White House earlier today. Admiral Burrell, who has overseen much of the distribution of the resources, was commenting that in a number of states that they had not been able to actually deliver certain goods in a particular day because they did not get there between the hours of 8 and 5. It struck me as incredibly important because our and your State Emergency Operations Center housed at the Haley Reeves Barber Building has basically been fully functional 24 hours a day, 7 days a week since the floods during the month of February. And so to the director and his team and literally the hundreds of Mississippians that are manning that, I want to personally say thank you on behalf of all 3 million Mississippians. We may not always agree on every single thing politically, but I think we can agree that we have an incredible team at the Emergency Management Agency here that's been built over numerous years. And so to the director and his entire team, thank you on behalf of the entire 3 million Mississippians that depend on you every single day. And also to Dr. Dobbs and his team, they also have been working around the clock. They also man their space at the Emergency Operations Center, and they have done incredible work. And I want to thank you and your team as well. We have come together as a team. We have come together as a state. We are making hard decisions, some of which are popular and some of which are not, and we understand that. But I can commit to you, to every Mississippian, that we are making every decision based upon what we believe to be in the best interest of the 3 million people who have entrusted us to these jobs. So with that, I'll open the floor to questions. Renee.
Vanessa with WGAM has a question.
Great.
Vanessa?
Yes, this is for the governor and or Dr. Dobbs. We come from the Pineville area here, Jasper being one of the counties and considered a hotspot. Our question is for Jones County, and I did hear Dr. Dobbs mention Wayne County as well, but looking at today's numbers for Jones County, it has passed the cases of numbers compared to Forest County, and it had 3 as reported today as well. So just wondering why Jones County isn't considered a hotspot, and I guess now Wayne County, and what can be done by either state officials or local officials on lowering these numbers, and what qualifies a county to be considered a hotspot?
Well, thank you for that. I'm going to let Dr. Dobbs answer this as well. One of the things I want to point out is, as you all know, we originally listed 7 counties that maintained additional restrictions back several weeks ago. This past week, we added Holmes County, so we now have 8 counties with those additional restrictions. What we are seeing amongst those 7 counties is improved numbers. There's no question about that. Dr. Dobbs and I had a conversation earlier today about Wayne and about Jones, and I'll let him address the specifics, but those are 2 counties that we are certainly monitoring very, very closely. One of the reasons that you see the number of absolute cases being at the top of the top 10 is because those 7 counties that we have put additional restrictions on several weeks ago are seeing lower cases, and so they're not as near the top anymore. And so with that, I'll turn it over to Dr. Dobbs.
Yeah, thank you, Governor. So, hotspots is not our term we're using, but we monitor every county closely, every community closely, and everyone has its own distinct characteristics as far as transmission. If we talk about the Jones County, about a quarter of it is associated with long-term care cases, and then or thereabouts, and then and another percentage is associated with different industries in the area. But the majority of it is going to be community transmission. And so we actually have been focusing some efforts on Jones County anyway, as we saw some increases. We've done mass distributions. I personally met with the Catholic Church there, trying to understand some of the community needs. So we are actively engaged also with the Community Health Center. So we understand it's an area that needs a lot of attention, and some of these core public health things that we're doing will make a difference. It does very much concern me that it's mostly community spread, and I'm worried that going forward, if we're not careful in communities perhaps where there's not good adherence to our personal distancing recommendations, where folks are doing, people getting back to church or having parties or social events and that sort of thing, that we're going to see some of that. And so we'll be diving into that with a little bit more depth in our case investigations. And I think a similar sort of scenario in Wayne County is quite likely. So these weekly metrics are very important for us to sort of keep real-time analysis, but also we have specific hot areas within, I'm going to say spots, hot areas within each community, and so we can narrow down based on where the risk is and try to do more personalized intervention.
And the other thing I will just add is, from my perspective, it is a good thing that we're getting asked questions about specific counties and what their numbers are doing on a daily basis, because what that tells me is that more and more people are doing what we've tried to do from the beginning, and that is actually follow the data and make decisions based upon the data. We shouldn't shut down Tishomingo County because there's an uptick in cases in Jones County. And so as we continue forward in this particular pandemic, that is certainly something that we're going to continue to do, monitor the data. We're going to look at it on a community-by-community basis, certainly on a county-by-county basis, and then we'll make decisions based upon the best data that we have at any particular time. Emily?
I have a question for Dr. Dobbs about the funeral that you mentioned. Where did this take place, and how did the health department find out about it, and what kind of monitoring is being done for the people who were there?
Yeah, so we don't release the details of cases where they are, but this may not be the only funeral we're investigating. So when we get a case report, so an individual was identified as a case, our understanding was symptomatic while attending the funeral. And then we'll do a case investigation, and as part of that, we'll see, where they might have been that might have been high risk, and then from there, we'll do a contact investigation to see, who might have been part of that event, so that we can then put them on quarantine orders as appropriate if they were exposed.
So the health department is not disclosing the location of that funeral, the county that was involved?
We'll have to go back and see about that, because we've had multiple funeral homes. Let me think about that.
Okay, and as far as contact tracing goes, you've mentioned in the past that the health department has roughly 200 to 250 people. Is that still the same, and do you need more people doing that duty?
We will certainly need more people doing that duty. We do have over 200 folks actively engaged. It kind of varies. We're adding more and more staff at this time. We have completed investigations for 94% of every case that we've had so far, with a goal of 100%, but some of that 6% not complete are new cases. So we're still trying to churn through all of those. Through the summer, we are going to try to add full-time staff, because we've pulled nurses, investigators, epidemiologists from their normal day-to-day activities, whether it's HIV, STD, tuberculosis, and we need to let them get back to their day-to-day work. And so we are actively recruiting, and on our social media, we have mechanisms for people to apply if they're in one of those disciplines.
And I think it's critically important that we continue to scale up, that we continue to build the team. That's going to be critical as we move into the late summer and into when schools reopen, and as we move into the fall. That's going to be critically important. But as a reminder, while the total number of cases continue to increase, and they're always going to continue to increase, they'll never decline. Total number of cases will never decline. That is not feasible. It's not possible. But if you look at the total number of active cases, when you know that 9,700 have come to fruition, where the patients have recovered, we have approximately 3,000 to 3,500 active cases today. That number has been relatively constant for months, and that's one of the things that we have to continue to monitor. But as those numbers progress forward, I think Dr. Dobbs continuing to build the team is certainly important. Renee.
Dave Elliott with WLOX has a question.
All right, thanks so much. Thanks so much, Renee. Governor, I have a very coast-specific question. As you know, I'm sure the shrimp season opens Thursday morning. The Mississippi Department of Marine Resources says all the regulations are going to be enforced. That means that there will be licenses and permits that are going to be required. The thing is, DMR offices, like so many other state agencies around the state, are closed. Shrimpers on limbo, they're frustrated, confused. I heard they were milling about down at DMR this morning. Why not go ahead and open DMR so these shrimpers can easily get ready to go by Thursday, especially since they're coming off such a terrible season in 2019 after the Bonnie Carey spillway opened?
Well, thank you, Dave, for that question. I actually signed an order sometime last week advising all state agencies to prepare a plan to reopen. Shrimp season is incredibly important. There are so many people on the Mississippi Gulf Coast that derive their entire livelihoods from the Gulf of Mexico. And while I didn't, you bringing this to my attention today is a good thing, and I will go back to the office and we'll do everything we can to fix this, to make sure that our shrimpers are able to get in the water bright and early Thursday morning. Renee?
Caleb with Daily Journal has a question.
Yes, I have a question about the prisons. I understand, of course, that Mr. Kane was just named his position, so he's very new there leading the Department of Corrections. So I'm just wondering what kind of conversations are going on to get him up to speed on what has been done and perhaps what should be done as this situation continues to develop with regard to staying on top of what's going on with COVID in the prisons.
Well, thank you for that question. You're correct. On late Wednesday afternoon at 2:30 at this press conference, I named that Burrell King would be the new commissioner of the Department of Corrections. We left this meeting and we went back to the office and met with the interim commissioner, Tommy Taylor, who has done a fantastic job given very challenging circumstances, but Burrell literally went to work that afternoon. I know that he met with the leaders at the department on Thursday morning, and they have worked for the last 4 or 5 days building their team, building their plan, and making good decisions. With respect to the department, we have now tested 69 inmates with 27 positives, 41 negatives, and 1 pending. With respect to the MDOC staff, we tested 72 staff members, of which 11 staff members have tested positive, and there have been 43 negatives with approximately 18 pending. And so we are continuing to monitor that situation. We obviously have prioritized testing for those in long-term care facilities over the last week to 10 days and for the next week forward. It will continue to make all testing a priority for those who have symptoms.
Bracy Harris with the Heckinger Report has a question. Bracy?
Thanks. Governor, I have 2 questions for you. I've talked with parents who have had a really hard time making childcare arrangements right now, and as a result have either missed work or left the labor force entirely. I wanted to ask you, A, what do you think this means for the state's ability to reopen and recover economically? And B, how is your administration responding to these concerns? Are there policies you're pursuing that can help stabilize the state's childcare industry during this time, so when parents are able to return or call back to return to work, there are providers there to provide them care? Thanks.
Well, thank you, Bracy, for those remarks, for those questions. I appreciate that. And you're right. The thing that we recognized very early on during COVID-19 was the challenges that were going to be created with respect to child care, and that was one of the reasons that shutting down our schools was an exceptionally difficult decision. I do believe it was the right decision at the right time, but it made it really difficult for many of those individuals who worked even in the early days in what were at that point defined as essential: grocery stores, healthcare workers, etc. We also defined child care centers as essential and ensured that no local governmental entity could shut them down. I think that was critically important as well. In addition to that, we have worked with our Mississippi Department of Human Services. We sat here at this table, I believe 2 or 3 weeks ago, outlining a plan whereby we would provide resources to any child care center that wanted to reopen, and we would also ensure that that the licensing requirements were relaxed such that we could get child care if for those individuals who needed it. Even with all the work that we've done in that area, we know that is a challenge. It is a challenge during normal times, but it's even more of a challenge today. And we are committed to continue to find innovative solutions, because child care is critically important, because if you don't have somewhere for your child to go during work, it's virtually impossible for you to go to work. If you can't go to work, that puts you out of the labor force, puts you out of the workforce, puts you on government benefits that in many instances you would really prefer not to be in a position to have to do that. And so it's one of many complicating factors of COVID-19 that we've got more work to do to solve it.
Craig Ford with WTVA has a question. Craig?
Renee, thank you, and Governor, thank you for taking my question. This is actually for Dr. Dobbs. We noticed in the latest coronavirus count, there was like a 35 case jump in Webster County in one day. I was wondering if you could just give us some clarity as to what led to that, if that's a data dump or there's something else to that.
We did notice that as well, and we're investigating, so hopefully we'll have additional information. We have a investigation format for different counties to see, if it's outbreak related, long-term care, or community transmission, and hopefully we'll definitely have something on that later today, and I can share that tomorrow if you'd like. Thank you.
Tim Reeves with the Vicksburg Post has a question. Tim?
Great, thanks. Governor, 2 questions. One is the casinos were allowed to reopen last week. How soon or do y'all expect to see any kind of impact from that opening? And have y'all heard anything in regards to their openings? And 2, is there an expectation, or I know there's a hope on many here and in other communities, that sports complexes will be allowed to reopen and start soon. Do you have an expectation of when that order may change to allow them to fully operate?
Yeah, well, thank you for those questions. Again, it's completely anecdotal, but my anecdotal information that I've received over the last 4 or 5 days is that the gaming industry that has reopened has done so in a safe, responsible way, that there were people who showed up, and what you have found is that there are those who don't want to attend a casino right now, and that there are those who do. And the great thing is we live in America, and now that's possible for those who want to attend to do so. When you look at the overall ramifications of the industry, and particularly as it relates from a revenue standpoint at the state and local area, and local governments that have the gaming industry in their jurisdictions are much more dependent on those revenues as a source of income than the state is, but it's still an incredibly important industry for the state. We collect about $150 million a year in state government from the casino industry. I looked at the numbers through the month of April. We had collected about $120+ million from the gaming industry. We had estimated approximately $150 million, so the maximum amount of loss, if you will, specifically in gaming revenue for the state's $30 million for this particular fiscal year. But of course, that just tells part of the story. There are so many other individuals that are employed, some 30,000 employed by the industry, and even more than that by those industries that supply the gaming industry. And so it's more of an issue of total number of employment and total number of unemployment in that industry that really has a major impact on state revenues and other items. And one more thing, make sure I answer this. The question was asked about ball fields. As I mentioned last week, I'm hopeful that we can get ball fields back open on June 1, which would be Monday, a week from yesterday. We're working on guidelines for a way in which to do that safe. I know that ball fields are incredibly important for many jurisdictions throughout Mississippi, and they're really important for young people so that they can get back to a sense of normalcy. But we have to make sure that events such as ball games and tournaments and things such as that we do it in a way that is safe for all of the participants, but also in a way that is safe for the community at large and ultimately the state at large. And we're hopeful to be able to do that early next week, approximately June 1.
Governor, and this is for both you and Dr. Dobbs, if you want to jump in. What did we learn from this first wave? And I get that we're still not, we're still in it, obviously. But what can you talk about in terms of what we've learned and how that knowledge will prepare us for the second wave that could hit this fall?
That's a great question, and that's a question that we spend a lot of time thinking about and a lot of time talking about. And so what I would say to you is that we learned a lot from this first wave. The one thing that we learned is that unlike the state of New York and unlike the state of New Jersey, Mississippi never had a huge peak. But because we never had a huge peak, we've had a prolonged plateau where our cases have been relatively flat. And again, you can go up or down 100 cases over or 200 cases over a 7-day period on a rolling 7-day average. But we've been relatively flat for 60 days in Mississippi. And so I think one of the things that we have learned is, number one, you can never have enough PPE in storage. And that's one of the things that we're trying to work through as we move through the summer. It's going to be incredibly important that our friends in the legislature understand that they help fund significant purchases of PPE so that when we go into the fall, we're not scrambling. The reality is, in the early days of this, a lot of us spent a lot of time working to find contacts that could get PPE to ensure that we accomplished our ultimate goal. And our ultimate goal has always been that every single individual in Mississippi that has COVID-19 that can get better with quality care gets that quality care. Having PPE for the healthcare workers is one piece of that, obviously. The other thing that we've learned is that as we have made various decisions and we're able to have the benefit now of looking back on how those decisions had an impact and what impacts they had, I think we can make better decisions going into the fall in terms of what we're able to shut down and what doesn't necessarily need to shut down, sort of where the transmission is occurring. For instance, in and around poultry facilities, it appears, and this is not only true in Mississippi, it's true across the country, there's more transmission occurring in communal housing than is occurring specifically inside the plant. Doesn't mean that it's not occurring inside the plant, but on a relative basis, it's those close living quarters that are the most problematic. And so, again, all of this is dealing with various levels and various degrees of risk. The other thing that I will tell you is where we made a decision very early on that we wanted to do everything in our power to test as often as we possibly could. We knew, particularly early on, and we took a lot of criticism for it, that our total number of cases per 1 million residents was higher than many other states that had much lower populations. But we also knew the reason much of that was the case is because we were testing more than other people. We've tested almost 55,000 per 1 million residents today, and we're going to continue to build out capacity for testing. And based upon our conversations with the Coronavirus Task Force earlier today and with what we are hearing, the federal government's going to be a partner in that, in helping us fund more testing into the future. We know that testing is important as we move forward. It is not a silver bullet, by the way. The fact that you test more does not mean that you're going to have fewer cases. In fact, in many instances, testing more means you're going to show more bottom line cases. What we've got to do also, and one of the things that we've learned is it is very clear that this particular virus is cruel to everyone, but it is particularly cruel to those who are over the age of 65. It is particularly cruel to those who have some underlying health condition, and it's particularly cruel to those who have a compromised immune system. And so as we move into the summer, into the fall, much like we're doing now by testing everyone in every nursing home, both residents and employees, it's that targeted testing and targeted ideas that are going to be critical that we minimize any future damage. Dr. Dobbs?
Yeah, and I'd like to echo the governor's statements. I think that's, he's obviously spot on. A couple things, social distancing does work, but I think looking back, we can find some things that more targeted could be implemented in a more strategic way that would be less disruptive. The things that we can do personally are effective, and if we personally do the simple things, we can collectively do the big things. So if we can go into the fall making sure that that we do the simple things, the 6 foot, the mask, the hand washing, those sorts of things, and also understanding these congregate sort of areas, as churches and funerals, weddings are really going to be high risk for mass transmission, especially these super spreader sort of events. Hopefully we can do a better job preventing those. Infection control works. We've had hundreds and hundreds of patients in the hospitals, but we haven't had hospital outbreaks to speak of, and it's because of the diligent infection control practices, which is very encouraging. I will make one diversion too. I did get an update on the Webster County, Ms. Ford. So of the new cases, 29 were related to long-term care settings and testing. So that accounts for the vast majority of the new cases in Webster County. Thank you.
Follow-up, Governor. Could you give a few other examples of things that maybe should have been closed earlier on, or maybe things that shouldn't have been, just to kind of give us some more perspective on that?
Sure. I don't know that I can tell you anything that should have been closed earlier. I've said from this stage many times that I did make a mistake when I identified essential versus non-essential industries. And we did it with the best of intentions. We did it so as to make sure that local governmental entities couldn't shut down a grocery store, for instance, or couldn't enact a curfew that would not allow for the truckers to get goods and services to the grocery store. That's the reason we initially said these are essential and these are non-essential. As I look back on it, I realized that we made a mistake, and by we, I mean I made a mistake, because there is no such thing as a non-essential business. Every business is essential to the owner, the small business owner, and to the individuals who depend on that job for providing food and shelter for their family. And so one of the things as I look back on things, and this is my plea to the people of Mississippi, if 100% of Mississippians would adhere to the social distancing guidelines, if 100% of Mississippians would adhere to the notion that we have to protect ourselves, if 100% of those Mississippians that were in a vulnerable category over the age of 65 or had pre-existing conditions, if they sheltered in place, then the likelihood that there would be a need for shutting down any businesses would be much less so. And so, again, we are all in this together. We all have to work together to make a difference. And as we look to the fall, my plea to the people of Mississippi is, if we will all do the little things, then it can make a huge difference for everybody. My grandfather used to say, if anybody who spends an enormous amount of time counting their pennies will never have to worry about their dollars. And in this instance, if everyone will do the little things that, by the way, 4 months ago didn't seem that little. Social distancing and wearing a mask and things such as that seem like a huge deal. But as we are dealing with it in the future, the more and more people that adhere to those guidelines, the more people who don't gather in groups of 200 for social reasons, the less likely we are to have outbreaks, and the less likely we are to have outbreaks, the less likely we have to make difficult decisions in the future.
Hunter Dawkins with the Gazebo Gazette has a question. Hunter?
Renee, thank you very much. Governor, thank you very much. As we saw earlier today in the press, at least got emails and such from the state economist Darren Webb sent out, addressing his speech to the Senate. Governor, I asked you, since you had said that of the economic recession that we're currently going through, are you going to use this analysis provided by the state economist to either keep things open or keep things closed, and not only during the summer, but in the fall?
Well, thank you, Hunter, for that question. I have not actually read the information that the state economist has given to the state Senate earlier today. I will. I've known Dr. Webb for a long time. I've worked with him, I believe, for my entire 17 years in government. He tends to be a little more pessimistic than I am, but he's an economist, and that's what he gets paid to do. And he's a good person, and is well. We're going to monitor the revenue outlook. We're fortunate in that I have had an enormous amount of experience dealing with the fiscal situation of the state, serving on the revenue estimating group for 8 years as state treasurer, working as lieutenant governor the last 8 years, setting very conservative budgets. And Mississippi came into this situation in much better financial and much better fiscal shape than we've ever been in the history of our state. And I believe we'll be able to get through it. It is going to be painful in the short term. We all know that. This entire episode has been painful in the short term, but we've got to make good quality decisions that put our state in a position where we can recover rapidly and where we can grow our economy rapidly, just like we were doing prior to COVID-19.
Erica Hensley with Mississippi Today has a question. Erica?
Thanks, Renee. Question for Dr. Dobbs following up on long-term care testing. I know it's important to identify those outbreaks because those cases are driving deaths now, and there certainly are more vulnerable residents. It also provides insight into kind of disease prevalence, though, by being the only targeted widespread testing of asymptomatic people, as Governor Reeves mentioned earlier. I'm wondering what kind of trends you're seeing in those 60% nursing homes that have been tested as far as asymptomatic cases, understanding it might be a little bit higher in that population because, the residents and employees are exposed more. But what kind of trends are you seeing that might be helpful for understanding of the disease burden later on?
Yeah, that's a fantastic question, and we'll have more detailed analysis once we get a little further into this. We haven't really drilled down. But what we are finding, if you look at the public health testing numbers, you can see the percent positive has plummeted because we've been doing most of the the nursing homes within our own lab, and UMC's helping us too. So we're seeing a lot lower percentage in the nursing homes. Nursing homes are going to be higher risk than the average location just because it has a tendency to sort of amplify internally, so it's going to be higher than the baseline population. But what we find is high variability. Most of the places that haven't had any cases don't have any cases, but sometimes we'll find a place that'll have 20, 30 people that we didn't really know about. So there's surprises lurking. I think one of the most important lessons is that universal infection control is so very important, because someone with very mild symptoms that may seem like an allergy could be coronavirus. And we've seen, especially in the older folks early on in the disease, they have very mild symptom complex and don't manifest fever. And so it just changed the paradigm a little bit of how we approach the infection control, and can't depend upon a symptomatic diagnosis to be our first line of defense. We really need to assume that everybody's potentially contagious and take those very important steps throughout the entire workday.
Yeah, and the only thing I would add to that is one of the things that we're learning, and I think we knew this going into it, but while, as Erica correctly points out, this is the first widespread testing of asymptomatic individuals, it's also important to note that the way in which they live in relatively small spaces and with one another creates a dynamic that is not true in the population at large. But also, we are testing a group of individuals that, by their very nature, are in that higher risk category, because they do tend to be older Mississippians, and they do tend to be those who do not, or in many instances have compromised immune systems or have other factors. And so for us to find significant numbers of asymptomatic positives is somewhat surprising, just simply because their symptoms tend to be worse. And that's why I think, as much as anything, testing the employees is something that I think is critical, because those employees go in and out of the facility, and so they have the opportunity to contract the virus and then bring it in, and that's why it's so critical that we test those employees.
Kobe with MPB has a question.
Yes, thank you. This is for Dr. Dobbs. You mentioned earlier an antiviral drug that will be distributed to hospitals across the state. Can you tell us more about that drug and how effective it's been, and what you hope to see it do in the state?
So there's been more and more study released on this medication called Remdesivir. New England Journal has a good study, if you want to look at it, that does show benefit in diminishing the duration of illness. It's a antiviral drug that was initially developed for other viruses, including Ebola virus, but it does have some properties that suggest that it could be effective against coronavirus. And we're still learning more from a research perspective. It seems to have a very good safety profile. It probably, anecdotally, seems like it might be more effective if used early within the course of treatment, which makes sense because you can prevent the damage if you treat folks early. We have already distributed it to the 29 hospitals and have had anecdotal reports of some potential good outcomes, but again, outside the context of a clinical trial, it's hard to know for sure if they wouldn't have gotten better. Anyway, so this is something that we'll continue to distribute. We have more being sent to our state public health pharmacy by Gilead and HHS, so we look forward to getting more of this product out to hospitals. It is for inpatients, though. It's an infusion, and it's only for hospitalized patients with pretty severe illness.
I just think it's important to note that much of the medicine that we are receiving to date has been donated by Gilead to the federal government, and HHS is making those distributions to the states. And so it's another area in which, while the response has not been perfect by anyone because we are in newfound territory, this is another example of a partnership between the state government, the federal government, and the private sector to help our fellow Mississippians. CJ.
This was for Dr. Dobbs. Doctor, you talk about hospitalizations. I wanted to ask you what makes a confirmed hospitalized case. What we're seeing in some states, particularly Georgia, is that a confirmed hospitalized case is only counted if someone is already admitted and then tests positive. If someone tests positive and 3 or 4 days later is admitted, that does not count. are we using that same methodology? And I know that you have two different totals. You've got, suspected cases and confirmed, but among the confirmed cases, is that the way we approach them as well?
And anyone who has a hospitalization attributed to coronavirus, and I feel pretty certain, I'll have to get back with epidemiologists, but I feel quite certain that if they were tested 3 days before and came in, we would absolutely count them without a doubt. And if they come in, they're a suspect, and we test them, they're positive, they go from suspect into confirmed case. We depend actually a lot more on the clinical judgment of the hospitals as a determination. So I feel very confident that we would catch those cases and would not discount those as coronavirus cases. Yes, sir.
I had something else to ask you about community spread. You mentioned that that's been a factor in some of these increases we've seen in recent days, particularly in Holmes County. You talked about it last week. Can you speak to any specific outbreaks in the county that might have contributed to this? It's my understanding that early on some of this could have spread through congregations, through churches there. We had some people who claimed, and again, these are claims, that a convention of sorts for religious leaders in the Delta may have spread there in March, and then when some of these preachers, ministers came back to their respective counties, they may have brought this back with them. What can you speak to any of that?
We haven't linked the case numbers to any specific event, and so we would call that an outbreak if we kind of tracked it back. But certainly we've heard anecdotal reports of people not really honoring the social distancing guidelines, and it's not surprising. And this is going to probably continue throughout the summer, where we will see these sort of flash events, because all these cases that we're seeing, say now in Holmes County, were transmitted 2 weeks ago. So, and I'm a little bit worried that when Easter came, people couldn't contain themselves and they had family gatherings, and those are the kind of events that are most worrisome. When you take people who don't see each other every day, I see my wife and my 2 kids every day, and they go to work and they study and they don't go out, and that's good. But if my grandma came from Alabama, or if my cousin came from Georgia, and we have all these people intermixing, changing the stability of that cohort group introduced risks. And so we really need to limit our socialization unless it's important. I mean, we have to do some things. We have to go to work. If it's not important and it's not worth the risk, let's just put it off a little bit. This isn't going to last forever.
Well, Governor, to his point, we're getting into these summer months, and you're going to have people that are going to want to go and barbecue. You're going to have people that are going to want to go to the beach. They're going to want to go and stay in a hotel in another part of the state, condos on the coast. What would you say to people who, are excited about those activities in the coming months? Even if we're just talking about pool visits, I know all of this seems like, 4 or 5 months ago we never would have thought anything about that, and now we're really trying to scrutinize our behavior a little more.
Well, and these are the questions that we ask ourselves every single day, and these are the debates that we have every single day internally, and many days they last hours and hours on end, is how can we safely reopen? And the best way for us to safely reopen is to provide guidelines that then individuals take on personal responsibility and adhere to those guidelines. And so, I think you mentioned a barbecue. There are degrees of risk. There's less risk in a barbecue of 8 people who are outdoors, who are staying 6 to 8 feet apart, than there is a barbecue with 100 people in a small room indoors where people are within touching area of one another. There are very varying degrees of risk. And so what we are asking people to do is not to take unnecessary risk, because you're not only putting yourself at risk, which is perfectly fine. That's part of living in America is an ability to put yourself at risk. But in some instances, when you go to a place, and everyone's seen some of these pictures out there, when you go to an area in which there are hundreds and hundreds of people that have come from various different regions of the state, come together, and you get a community spread, and you go from 1 to 50 that have it, and then those 50 individuals go back into other communities, and those 50 people infect 4 or 5 or 6 people, that's when you start seeing significant challenges. And so our plea to every Mississippian is understand that social distancing, while a pain is here to stay. It's here to stay for at least the foreseeable future. But we can maintain our life and our livelihoods while experiencing social distancing. Understand that the ability to wear a mask while a pain is something that can be very helpful in reducing the amount of spread if either you have it or someone you come in contact with has the virus. And so all of these things are not normal. It's not what we as Mississippians are accustomed to, but it is. These are things that, in talking with our public health experts, that we really do believe can make a difference. You know, when we talk about if and when we're able to reopen ballparks, or at least make it not against the law to open ballparks, which I understand that we don't get 100% compliance in any of our laws, unfortunately, and that's one we probably are not getting 100% compliance in right now. But the reality is, part of going to a 10-year-old baseball tournament is the camaraderie between and amongst teams and between and amongst fans and everything else. Well, that baseball's got to look a little different this summer. We've got to spread out along the fences and maybe even around the outfield so that, one family of 4 can get together in a relatively small group, but we don't need 15 families of 6 getting together in a small group, because that, again, brings with it a higher level of risk. What we are talking about in many instances is risk mitigation. We're not going to eliminate the virus. What we hope to be able to do is slow the spread of it, continue to flatten the curve, which we have been successful at because Mississippians, by and large, have adhered to the guidelines we put in place. Our plea is, as we move into the summer, as we open up more and more and give you individual freedom, we're just asking you to make good decisions. Make smart decisions. Be safe. Be careful. Take care of yourselves, which ultimately takes care of thy neighbors.
Lacey from Hattiesburg American has a question.
Good afternoon, Governor. I was calling because I want to find out what kind of conversations that you and Dr. Dobbs have been having about the increase in numbers of the younger adults. I mean, we've talked a lot about the older communities, staying home, protecting themselves, not exposing themselves. But if you look at the numbers, the 18 to 29-year-old, for example, that's the higher numbers that we're seeing of cases, and the same for all of the other younger adult categories. And with the start of school coming back in the fall, what kinds of things have you guys been talking about to try to help mitigate some of those numbers going up when they're going to be together a lot more?
Right. Well, thank you for that question. And what I would say to you is that there are a large number of cases between those 18 to 29-year-olds. There's 2,349 cases being reported today between 18 and 29-year-olds, but there are only 2 fatalities during the duration of this event for those in that particular age group. The same can be said for those in the age group above that, about 2,180 cases, but only 10 fatalities. Again, that's 12 amongst a group of about 4,500. That's 12 too many, and I certainly pray for the families every single day of those individuals. But one of the things, there are a number of factors as it relates to that, and it from a seriousness standpoint, most individuals that are under the age of say 60 that get the virus end up getting better. The vast majority of our total confirmed cases that have run its course, if you will, for those under the age of 60 have gotten better. And so one of the things that I would say is we need to continue to communicate with our younger generation, because the reality is in many instances we need them to be adhering to the guidelines and to social distancing, etc., because while the virus may not end in death for them, they could be either a symptomatic or an asymptomatic carrier of the virus, which then puts other people at risk that they have no intention of putting at risk and really don't want to put their grandmother at risk. But that's just a reality of it. And so the social distancing guidelines, wearing a mask, should be implemented and utilized by all Mississippians.
Yeah, I agree entirely. It's going to be so very important for our younger aged folks to be really compliant with social distancing, or it's going to really accelerate transmission, especially as we get back to school. It's going to be so very important. One of the things, too, if we look at the increased numbers in that age group, it also probably reflects different testing priorities. You know, we're testing more and more young people in the workforce. Our triggers for testing initially was hospitalization, right? So that was most of the folks, and that's going to be the sicker folks. And as we've sort of expanded testing more broadly, we're going to pick up a lot more folks with either lesser symptom complex or people who are asymptomatic altogether.
Craig with WTVA has another question. Craig?
Yes, a couple for Dr. Dobbs. I think we're a little more than 100 days before the scheduled start of college football in this state. How much consultation have you been involved with the universities in that regard? And as the state health officer, what do you need to see to make you comfortable to sign off on the start of football on September 5th?
Boy, that's a good one. No, so we and Dr. Byers specifically have been in close contact with IHL and the colleges talking about how to be safe. We certainly anticipate that NCAA will probably make some wise decisions as they go into this. Personally, I think it's kind of extremely troubling to think about tens of thousands of people crammed into a stadium screaming at each other. It's hard to envision a reality where the normal state of affairs is acceptable. But we're working with IHL very, very closely and understand where the priorities are. And the priorities that we have, well, that we all should have is the education. And so we want to make sure that students, both, you know, K-12 and college can get on and get their lives going from the educational perspective.
Tim with Vicksburg Post has another question. Tim?
Thanks. Dr. Dobbs, this is a housekeeping question, I guess, and if this one has been answered, I apologize. But on the daily reporting of long-term care cases with each county, is that a cumulative number or is that a active case number?
That should be a cumulative number if I'm thinking of the same one. But I'll have to go back. That like 4 rows, that a 4-row sort of spreadsheet. Is that it? That should be a cumulative number.
Is there a chance at any point in time that becoming a number that would show active cases, much as the way y'all have handled presumed recovered cases?
Oh, like a day-to-day by county?
Just as, you know, because we have that guidance in the way to kind of estimate active cases or those recovered, but being able to do so on a long-term care facility number would be, you know, would be interesting to find
the
out.
number responding who've recovered from long-term care. That is a good question. I'll get with my team.
Dr. Dobbs, go ahead. I'm sorry. Have we seen any other cases of that inflammatory disease in children?
We do not have any more confirmed cases, but we've had some investigations going on, and if we get more, we'll certainly let you know.
And I have one final question for Director Michelle. What plans are in place for community PPE distribution as this pandemic continues?
Yeah, so as I mentioned earlier, we started distributing community masks about 2.5 weeks ago. We've distributed 2.25 million right now, and we've got an additional approximately 3 million that will be coming in that we're getting from HHS/FEMA. Not all of those masks will be distributed immediately. Many of those will be pushed back for other community events, primarily talking about shelter operations during hurricane season. What we have done as far as the distribution of those masks is each of the 82 counties in the Mississippi Band of Choctaw Indians, they've all developed their plans of distribution. As you can imagine, they're all different. Many of them have been managed at the emergency management level. A lot of them have been turned over to the cities, municipalities, or counties, but they are being distributed as those counties see fit. we prioritize the distribution of those initially to those 7 counties that the governor and Dr. Dobbs mentioned about a week ago that were under the first strict additional guidelines for COVID.
And let me just say that this is a good story. This is something that we ought to be proud of. We as a state have, I believe, done phenomenally well in many areas. We had made every decision that was the right decision. But let me just highlight that again. In Mississippi, a state of 3 million people, we have distributed 2.25 million masks for the community. Now, this doesn't include K95 or KN95 masks that we're sending to long-term care facilities. It doesn't include the masks that we're sending to our hospitals. These are masks for individuals in our state that might not otherwise have the ability to get one. And so this is a prime example of the director and his team stepping up. And we have more than that on the way from HHS, which we're very pleased and proud to get. But we have over a very short period of time, the potential of putting out almost 5 million masks in a state of 3 million for the community. And so we didn't have any means test by who could and who couldn't get it. We literally made it available to every single Mississippian. If you need a mask, there is a way in which to go get one through your emergency operations center. And we believe everyone ought to be looking for the opportunity to get a mask. So with that, it's a little after 3:30. I know we've got another meeting to attend. Thank you all for being here, and for those of you who joined us online, we will see you again, I'm sure, tomorrow with more updates as we progress forward. Thank you all. Stay safe, and God bless.